Hi everyone, my name is Will. I'm one of the physios at 360. Today we're going to be talking about Quervain, which is a painful condition that affects your thumb and your wrist. It's to do with the tendons that help lift your thumb up and out to the side a little bit. Specifically to do with the outer layer of those tendons becoming inflamed, overloaded, overworked, and it can be difficult to get rid of or treat. One of the ways in which we do that is with splints to help the wrist and the thumb rest. The purpose of it is to keep the thumb in one position, allowing the tendons to relax and settle down the inflammation. But it should be used in conjunction with good physio and exercises to help load the tendons over time, improving the strength and the integrity of those tendons, reducing inflammation as well. You can get splints that are over the counter. Sometimes they're not the most comfortable, and that's when we might come in to make a splint for you using thermoplastic material, which is this stuff. When it's heated up, it becomes soft, and then as it cools down, it hardens again. So we can make splints that fit really well to your wrist and thumb, that are comfortable, and more importantly, keep it in a really good position so that things can settle down and get better. And that's what we're going to be demonstrating for you now. So we start out by getting a stencil using a bit of paper. So we mark parts of Sophie's hand and wrist onto the paper, cut that out, and then use that stencil to cut our piece of plastic out. Once we've got that made, we put it into the hot water bath so it can soften. Cut it out, make sure it's the right shape. Bring it over to Sophie to shape it to her hand. Then once it's the right shape and it's comfortable for her, we cut out Velcro, put those straps on. So the final bit of it is just popping on these lovely Velcro straps. Keep it in place for Sophie. Also really handy because you can take it off, remove it whenever you want, keep it clean, and then Sophie's got a really nice bespoke splint there that's going to keep her thumb in a really good position. So with the splint made now, you can see it's blocking the thumb joint at this joint and this joint, so the wrist is blocked as well. You can still wiggle the tip of the finger, so it's quite functional. You can still pick up things. It's quite useful for still being able to do things when you've got it on. Obviously, with the Velcro, you can take it off. You can clean it if it gets a bit smelly. If it needs any adjustments, it's really easy for us to remold it, heat it up again, and then make it more comfortable for you. The purpose, just keeping the wrist and thumb in a good position so that the tendons can be offloaded, so to speak, and allow them to calm down, inflammation to calm down, pain to calm down. Begin doing physio, reloading those tendons so that they get stronger and then eventually aren't a problem anymore.